A doctor's presence is the first step towards cure. Hello and welcome all of you to yet another episode of Meet the Masters. And today the Medibus TV camera crew is at the premises of MedArt Clinics, and I am in conversation with Dr. Jamal Jomah. I'm holding this business card in my hand for the simple reason that he is a consultant in the portfolio of plastic surgery, hair transplant and laser surgery, and his portfolios are so large that I'm forced to hold the business card in my hand. He is the General Secretary of the Emirates Plastic Surgery Society, the Governor of the American College of Surgeons, Saudi Arabia, National Secretary of the ISAPS, Fellow of the American, British and Canadian Colleges, and the list goes on. And I am in conversation with Dr. Jamal. Welcome to the show, Doctor.
Hi.
Doctor, tell us something about yourself. You have a huge portfolio when I had read your profile. So the viewers would like to know more about yourself and the clinic as well.
My name is Jamal Jomah. I'm a plastic surgeon. I am a Saudi national. I was educated and I got my medical degree from Saudi Arabia, and then I went to Canada to pursue my specialty. I specialized in plastic surgery and then sub-specialized in cosmetic surgery and then sub-specialized in medical education and facial reconstruction, and also did sub-specialization in hair transplant and laser surgery. Following this, I got my fellowship in Canada, I got licensed in Canada, and I got the American board, and then I got also the UK fellowship. I was practicing in Saudi Arabia. I was initially an army officer, and I participated in the Gulf War, 1990. I was received several medals from both the Kuwait government and the Saudi government, and I continued my career as an army officer and an army physician for a few years, and then I changed my career into private practice. Currently, I practice in Saudi Arabia and in Dubai, and I keep traveling between the GCC countries. I am also very active in terms of the societies, both internationally and nationally in Saudi and in the United Arab Emirates. Internationally, I'm the governor of the American College of Surgeons, which is the most prestigious agency or most prestigious college for surgeons all over the world. And I'm also the educational committee co-chair for the MENA region for the most prestigious society in the world, which is the International Society of Aesthetic Plastic Surgery. We conduct courses throughout the MENA region, and we're having a course coming up in Dubai and in Saudi Arabia and Bahrain and in Jordan, Egypt, Tunisia. Throughout the MENA region we have courses I'm in charge of. I'm also in charge of the trauma life support courses in affiliation with the American College of Surgeons. I'm the course director for the trauma courses. Well, I don't know if I should continue talking about myself.
Doctor, tell us something about your team, both in Saudi and Dubai.
Yes. Saudi, I have several clinics. We have a chain of clinics in Saudi and in Dubai. The teams is both number one clinical team that consists of doctors and the nurses and the aestheticians and the physiotherapists and occupational therapists. And then we have also the logistics team, which is the managers, the business administrators, and the coordinators, and the also the health educators, both in terms of digital health education and promoting health in the community directly or through contributions in the local media.
Well, Doctor, now to take the cat out of the bag, there's always a confusion, a dilemma, a lack of script in the so-called difference between plastic surgery and cosmetic surgery. First of all, is there a difference, or what are these two departments in whole?
Okay, a good question. Plastic surgery is the general term.
Oh, it's a general term.
The general term that branches into cosmetic surgery and reconstructive surgery. Basically, reconstructive surgery is a surgery where you rebuild any body part to achieve a better function. So reconstruction is function. Cosmetic is beauty, is where you enhance the looks of the body or the organ to make it look better and more harmonious with the rest of the body. So plastic surgery, two categories, two specialties: cosmetic, which is equals beauty; reconstructive, which is equals function.
Time and technology changes so fast. What are the recent developments in the field of plastic surgery in terms of 2000s? Let's put it this way. The year is 2016, so there have been enormous developments in the field of plastic surgery. So viewers would like to know on the developments, treatments, equipments, you name it.
Okay. There are various developments in both categories of plastic surgery, both reconstructive and cosmetic. And the reconstructive development is steadily going up in a very solid way, but in a slow pace.
Okay.
Because the function is the same this year, last year, the year before. So any progress in terms of improving function is the same towards the goal of improving that function. The technicalities may vary, but the strategic goal is the same. While the cosmetic surgery, the goals keep changing. Every year it might change. Why? Because beauty is something dynamic. It changes every year, changes every few years, depending on the population, on the geographical location, on the interest, and on the influencers. Those who are in the media, the stars of the movies, the stars of the media, they also influence how people think of what is their goal. So the cosmetic surgery evolves faster than the reconstructive surgery. But both are hand in hand. They grow together because beauty without function is not worth it. And function with minimal beauty is not as good as when it's more beautiful. So the trend these days, what is making the news for both reconstructive and cosmetic, which is very rare to see this combination, is the advancement in 2016 is the 3D and the 4D. The 3D plastic surgery and the 4D plastic surgery. The past years, we've looked at the advancement in terms of the lasers, in terms of the technologies, the new equipment, but now we're looking into going back into sculpturing, which is the basic skill in plastic surgery.
Okay.
The introduction of 3D and 4D. And 3D is when you create the body or an organ in the body, and it's on all of its dimensions, length, width, and depth.
Okay.
The 4D is when you add the element of time, so that it's not only static, it's a dynamic thing that keeps on changing. The most recent trend is to have the 3D body sculpturing. And before we get to that 3D, we also look at 3D preparation, 3D planning, and 3D explanation. So now what we used to do in the past, when we see a patient, we talk to that patient, we take pictures of that patient, and we create a plan for that person. Let me make it simpler. It's just like a TV.
Okay.
Those who are in the media now, you see the movies have changed, has evolved from a 2D flat screen to 3D TVs, 3D movies, and 4D and high definition and ultra high definition. This is also the same thing in plastic surgery. We have 3D and 4D and ultra high definition. Let me give you an example of what is 3D planning and 3D preparation. See, this is a 3D model.
Okay.
Now we can create a 3D model of the face or of the body. So in this 3D model, the patient sees herself
Okay.
as a mirror image. This has the exact details of the patient. And then when we talk together with the patient, we are talking about the patient, but on the model here.
Okay.
So, for instance, this patient came in for a rhinoplasty. So she tells me that, look, I have a hump here. My nose is slightly long. My nose is slightly wide. I want you to change this malalignment. It's shifted towards the left. So these are the things that when she looks at her nose, she sees all these features. And this is how I perceive it, and this is how we become in the same wavelength. So once she explains on the 3D model what she wants, then we can take all of these comments. We'll see if we can make them happen surgically. And then we create a simulation. This simulation is on a flat screen first, but in a 3D flat screen.
Okay.
And then we can show it to the patient. As you're watching TV and a 3D TV, you can always wear goggles to see the depth. Now there is a new goggle for the 3D modeling in plastic surgery. Patients wears it, and she sees the changes on the flat screen. But the flat screen may not be enough. So what we can do is we can also create a 3D simulation.
Okay.
If the person, this is what you want to look like, is this how you want to see yourself? This is when you look at yourself from below, this is when you look at yourself from the top, this is when people look at you from different angles, you can see that. So this is how it's going to look like. So when they see this, they appreciate the changes. This way, the doctor and the patient are on the same wavelength. This way, there are no surprises after the surgery. This way, the people will understand all the changes that will happen. This has facilitated our work. It became easier now. We have less confusion about what the patient requires and what we can achieve in the surgery. And this will also help us at the time of the surgery. When we know that this is what they require, we are trying to achieve it. We look at the model. Before we used to look at the picture. Now we look at the model and see what are the...
What is the time frame for such a correction? How long does it take to undergo such a process?
Well, taking the picture doesn't take long. It's only a few minutes. Processing this, if you want an actual print of the patient, it happens within 24 hours. Before, I used to send all these files, all these pictures abroad to the US to get it printed and have the models. But now we can have it made locally here.
Okay.
So it can be printed locally. We're in contact now with a printer that does all this, and it does it for lesser price, less time, and faster delivery.
Well, doctor, I know you are an experienced campaigner, but the fact is that you are continuously dealing with people, with celebrities, or with different categories and corners of people. Dealing with machines is a different ballgame, but the fact is you're dealing with people, their emotions, their security, their privacy, their quality, and they're all private. They want to be covered and so on. So, what is your take on that, and how do you deal with such cases?
I'm happy that you mentioned this point because I think this is quite important. When we were in medical schools and in residency training, we used to treat diseases. We study disease, see its effects. We are not studying the human nature. This is something that we develop with time. Some people are more of a people person. They are very compassionate. They understand people. Others are studying the literature, reading the journals, and going through the books, staying away from the human factor. But the human factor is very important. And in plastic surgery, we don't deal with one person. Every individual has his own identity, has his own culture, has his own perception of what is beauty and what is required. So this study starts from when the patient walks into the clinic. When that patient meets the reception, everybody is welcoming that person, making him or her feel comfortable, and they also study what is this patient's requirements. There are patients who are asking for a very reasonable thing, a very common thing, and that can be achieved. But there are some patients who are seeking perfection and want to reach the moon and have everything done in one stage. So we have to work with all personalities. We have to understand all personalities. We have to be not only physicians, we also have to be friends. So the plastic surgeon always becomes a friend of the patient, because the friendship builds the trust, because this patient is going to give you and is going to trust you with the most important thing that is he's emphasizing on. He wants you to correct, he wants you to improve it. Therefore, you need 1 consultation, 2 consultations, 3 consultations. You need to sit down with the patient to study their personality, and then also it's vice versa. The patient is also studying the doctor. Patients nowadays are not, they're well informed. They go into the internet, they find out a lot about the doctors. They walk from one clinic to the other. So until they find somebody who can understand them, and they always go to the person who simplifies things to them, who comes down to earth with them and goes in the same wavelength as they are. So studying human nature is very important. Understanding the patient's background, understanding the patient's beliefs, respecting his own desires and wishes, and also guiding the patient towards what is best for them. Sometimes they may think that this is what I want, but this is not what they really need. For instance, a patient who wants a nose job, and she wants it because of the influence of the media and the movies. They want to look like an ex-actress or an ex-actor who happens to be a Western actor or an Eastern actor or whatever, but they want to make the nose look like that Western face. But that Western nose has different characters than the Eastern nose.
Oh.
And the Eastern noses are different. The Arabic nose is different from the African nose, is different from the Indian nose, is different from the Persian nose. So you have to understand their culture and where they come from. If you give them a very beautiful Western nose on an Eastern or an Asian face, it will not look harmonious. It may look beautiful on its own, but it doesn't look good with the rest of the body. So a person may be happy with the nose, but they will not be happy with the overall result. And this is very important when we talk to the patient to understand what they really want, and we also advise them on what they can achieve and what is good for them, what is better. And this is why simulations and 3D printing is important, because this way they can see and they can touch and they can feel how they would look like after the surgery.
Now, I'd like to ask you about the affordability factor of plastic surgery. There is a myth in the market saying that it's a costly affair, and the so-called only the rich can afford to get plastic surgery done. What is your take on that?
This plastic surgery is for the quality of life, for the people who want to enjoy more from their life rather than just cure a disease. It's not a disease. Plastic surgery is geared towards those who are comfortable, who are healthy, and who seek to improve their appearances. The good thing about plastic surgery, there's a big spectrum from the minimal procedure to the maximum procedure, from the minimal amount to the maximum amount. So the prices may vary and they change. And the good thing about plastic surgery also is that there are so many people now doing cosmetic procedures, so it made the prices drop. I'll give you an example. There is a number of plastic surgeons here on our main street on Jumeirah Road. There are close to 100 plastic surgeons on one street. What is the population of this city? Maybe 2 million, 3 million. It's too much. Therefore, the prices have dropped, which is good for the clients. But plastic surgery is not about having your car fixed or having your some machine fixed. It's having an artist work on you. When you want to have a painting, a very precious painting, then you go to a famous artist who can do it for you, but it will cost you a lot. But if you want cheap artwork, yes, there are cheap artworks. So the plastic surgery, the prices vary by the experience of the surgeon, by the requirements of the person, but the basic things are affordable all over. And there are procedures that can be done under local anesthesia, that are procedures that are done under general anesthesia. Therefore, all of these items dropped the prices and it became more affordable.
I'd like to also ask you to touch base on the length of treatment. I know, as the different treatments take different compositions of time, but if you could just give a layman's talk on the length of a particular treatment which you feel that you've experienced with a particular client or something like that.
Okay, well, length of the treatment, if the treatment is a small procedure like having a Botox, it takes only a few minutes to perform and the results will last for a few months. The recovery time is quite quick. There is no downtime at all. And this is what people prefer now, least downtime, because that's how they want to have it done over the weekend so that they can go back to work on the beginning of the week without having any bruises. So these are the procedures that are very popular. Having fillers, Botox, body contouring, non-surgical procedures, non-invasive. These are the things that are gaining popularity. The things that require more recovery time, which may extend up to 2 weeks. These are normally the procedures that are in the exposed areas, like in the face. Bruising may last up to 2 weeks, therefore patients prefer to have it on their vacation time, and the recovery is dependent on the procedure that was done.
Well, doctor, to wind up the show, I'd just like to conclude by asking you is that what is that one message that you would like to pass on behalf of your portfolio, your trade, your profession, and so on, being a person holding so many positions in the world?
Well, I would like to advise and encourage people to be more natural. The more natural you are, the more beautiful you are. And beauty always comes from within. If you feel good about yourself, you will look good. And if you don't feel good and you look beautiful, this does not reflect, does not show your beauty. So number one, think of the inner beauty. Number two, think of being natural. Number three, do not imitate. Do not try to be somebody else. Do not try to look like somebody else. Be yourself. This is very important for everybody, especially for the younger people. Now the younger generation, the teenagers, are being influenced from a lot of sources. But always be yourself. Build your own character and have your own unique beauty. You will never look like somebody else, so don't try to be somebody else. Have your own beauty, and the beauty that matches your face, matches your body. This is more important than looking like somebody else.
It's a privilege and a pride to share space with an eminent personality like you. And the next time we come to do an interview with you, we look forward to see you in greater heights. Thank you very much.
Thank you very much. Thank you.